Welcome, everyone, and thank you for joining the Westchester County Youth Bureau and the Westchester County Youth Board as we discuss preparing for summer. This is actually our second segment. Last year, we were in a very different space, and we are very happy to have an amazing lineup once again with experts across Westchester County that are present in the medical field as well as the positive youth development field. And as parents and young people are making decisions regarding whether or not they will attend summer programs, summer camps, if they should vacation, we thought that it was really important for the Westchester County Youth Bureau to inform the broader community on prevention, early detection of communicable diseases such as COVID-19, but also talk about the wins that we've seen in terms of vaccinations, as well as, just some concerns that we've been hearing. And we'd like to discuss, how COVID-19 still is present and how we can remain safe. So with that said, I'm going to introduce my co-pilot for the evening, Reverend Smalls, who is a prominent member of the Westchester County Youth Board. Reverend Smalls, would you like to say hello?
Yes, hello. Thank you so much, Dr. Harris Madden. As she said, my name is Reverend F. Ramel Smalls, and I'm one of the proud members of the Westchester County Youth Board. And this is a wonderful and a very important discussion. So I'm looking forward to asking questions and hearing and learning about how we can keep our children and youth safe and involved and supported during this summer.
Thank you, Reverend Smalls. I was remiss in not even saying my own name, but thank you for mentioning that I am Dr. Damia Harris Madden. I am the Executive Director of the Westchester County Youth Bureau, and I am joined in the background by our new tech guru, Mrs. Susan Weissman of the Westchester County Youth Bureau. And so to all that are watching today, we really appreciate you taking the time to learn a little bit more about COVID-19 and where we are today. We are going to have greetings from our county executive, Mr. George Latimer.
I'm very happy to be participating along with all of our viewers, our parents, and young people in this webinar, Preparing for Summer, COVID Safety and Guidance for Youth. We have many distinguished panelists as part of this program, and it's designed to help parents and young people of working age make decisions based upon the new updates of COVID infections and the encouraging vaccination rates. There's a discussion of how summer programs and camps help children and teams physically, socially, and emotionally. We want to thank the moderators, Dr. Damia Harris Madden, who's the Executive Director of Westchester County Youth Bureau, the Reverend F. Romale Smalls, Westchester County Youth Board. And we want to thank all the panelists, Melvin Campos, who's the Chief Executive Officer of the Boys and Girls Club of Mount Vernon, Alyssa Ozar, Esquire, Boys and Girls Club of Northern Westchester, Dr. Sheila Nolan, medical doctor, MSCE, Chief of Pediatric Infectious Diseases at the Maria Ferrari Children's Hospital, and Dr. Mil Etienne, medical doctor, Master of Public Health, FAAN, FAES, Chair of the Westchester Medical Center Health Hudson Valley Regional Chief Executive Officer, Hub Vaccine Health Equity Task Force, all very capable and qualified commenters who served as panelists today. And now, let's go back to the webinar.
Again, we are so grateful for his exceptional leadership, and he always avails himself to the Westchester County Youth Bureau, our youth board, and to all of the Westchester residents, especially regarding important matters such as COVID-19 and keeping our young people safe. So I'm going to jump right in because this is a conversation that we're having tonight. And we are so fortunate to have Dr. Sheila Nolan, who has a litany of successes in her role with Westchester Medical Center's Maria Ferrari Hospital. But I'm going to allow her to introduce herself. And if Dr. Nolan, you could tell us a little about the role you've played during the last 16 months throughout the pandemic.
Hi, thanks so much, Damia, for the welcome and those kind words. So my name is Dr. Sheila Nolan. I'm the Chief of Pediatric Infectious Diseases at Maria Frere Children's Hospital and Boston Children's Health Physicians. It's been a busy 16 months or so since the onset of the pandemic for all of us in the medical field in general, but in infectious diseases especially. So part of my role is I oversee infection control, both for Maria Frere Children's Hospital as well as our outpatient practitioner group. And so that has been an enormous challenge in trying to keep all our practitioners as well as our patients safe and keeping them protected from COVID. And as well as I am, a frontline provider, and I do see patients with infectious diseases, and it has been very well dominated by COVID for much of the last year or so, and so we were, since the epidemic started essentially in the United States in Westchester, we were one of the very focal points initially with a lot of cases. We were one of the first areas to see the multisystem inflammatory syndrome in children. And so, we partnered with the Department of Health in trying to describe those cases and understand that and propose treatment for that as well. So that's a little bit of what I've been doing over the last year.
Thank you, Dr. Nolan. And last year you joined us and the distinguished panelists, which we had at least 5 physicians because we were in the height of COVID and there was so much that was unknown. And we had a litany of questions, concerns, fears. And so today we'd like to ask you about the landscape and how some of these things have changed. Hopefully you'll say for the better. But if you could kind of talk to us about the differences this year versus last year, and also if you could discuss the distinct differences in the clinical presentations of COVID-19 in children compared to adults.
Sure. So yes, definitely, this is a very different situation than we were in last summer. And I think, the key difference right now is that we have a vaccine. And so we do have the ability to protect at least a significant proportion of the population from this, potentially devastating virus. And that's a huge, enormous difference between last year and this year. So, last year we had masks and hand hygiene and physical distancing. But this year, we have all of that still, and we still need that, but we definitely have that vaccine, which has shown and been demonstrated to be extraordinarily protective against, symptomatic disease, but especially against severe disease and death. And so that is crucial for those of us who, want to get together and see people and see family members and that sort of thing without the worry necessarily of, especially older people and other people who have other risk factors for COVID-19, there is that, very significant element of protection for them. And I think we can feel a lot safer about seeing people. However, there is a proportion of our population, and since I'm a pediatrician, that are not eligible yet for the vaccine. And so, when we do have little ones in our household under the age of 12 who aren't yet eligible for that protection, we need to keep that in mind. We understand a lot more about COVID-19. We understand a lot more about people who are at highest risk. But, we still do see cases of people who seemingly have no risk factors who can develop severe disease. And in children in particular, we do know that they can get severe disease. It's much, much less than in the adult population. But there are children who can develop COVID pneumonia, similar to the way the adults do, and can have, you know, a lot of trouble with that and end up in the hospital pretty sick. And we also know more about this multisystem inflammatory syndrome, but again, we still don't know who is specifically at risk for that, and you know, which kids will end up getting that. And so that's sort of, you know, for me, one of the things that I worry about most. But you know, we do know that there's definitely ways to continue to protect our children, as we have for the last year and a half, essentially, by, you know, when we're getting together with groups of people, with people we don't know, with unvaccinated people, you know, wearing masks and high-end hygiene and those kinds of things. We do know definitely that the virus is not as easily and readily transmitted outdoors as it is indoors. You know, really what we saw this year with COVID was essentially similar to what we see with other respiratory viruses that predominate in the winter. And so really once people started going indoors, we started seeing the rates of COVID go up dramatically. And that's similar to what we see with flu each year and with other viruses, especially that hit children, like RSV and some of the other parainfluenza viruses and different viruses. So that's, you know, I think we definitely do not expect a significant summer surge as far as the numbers go this summer, but we will see what I think is continued spread among children. I think it'll be at a lower level, but than what we saw, you know, last year among unvaccinated adults. So that's definitely, you know, something I think we all need to keep in mind when we are going to the grocery store, now that, you know, so many people are not wearing masks in different areas. And, you know, so we do need to keep in mind that, you know, our children are potentially vulnerable. Yes, the majority of children have, you know, limited disease, but there definitely are those kids who can have more severe disease. And, you know, especially if you have a child who has risk factors for more severe disease, underlying respiratory or cardiac problems, that, you know, we definitely want to do our best to keep them safe.
I'm so glad you mentioned that because I was going to move on to Miss C, but you touched upon something that, you know, I'd like to ask just in terms of what we're seeing with children with more acute illness. Do we find that it's less now than it was before? I know we talked about the range last year in terms of newborns presenting with fever and, you know, limited respiratory symptoms, whereas teenagers had moderate to higher respiratory symptoms. So do you find that there's a difference today than, let's say, last year during this time in terms of the manifestations of the illness? And if so, or if not, what might we advise parents to do so that, you know, they can be aware of these potential secondary or even primary symptoms that may affect children and young people?
Yeah, so, you know, we definitely are seeing essentially the same presentations. It hasn't changed necessarily over the last year. We're definitely seeing, I think, less newborns coming in, and I'm hopeful that that's because moms are getting vaccinated and understand sort of that they definitely, if they do become symptomatic, that they need to protect their newborn. And, you know, if we are symptomatic with a respiratory virus, especially with a newborn around, you know, it's very hard, obviously, to separate mom and baby. But wearing a mask is what we, you know, generally tell women during flu season if, if you were to become symptomatic, that, just by wearing a mask, you can dramatically reduce your ability to spread. And so I think, being observant of that has helped reduce the number of newborns that we've seen, as well as, vaccinating moms and that push, because we do also now know we didn't have clear data necessarily last summer, at the beginning of last summer, but we do have clear data now that pregnant women are at risk for more severe disease with COVID. And we've seen a lot of very sick pregnant women at the medical center, and definitely having more severe outcomes than non-pregnant women of similar age groups. So that's definitely a concern. As far as, it's definitely the teenagers who tend to have more comparable disease to what we're seeing in adults, needing oxygen, having more severe respiratory presentations. But we've had kids of every age who have come into the hospital essentially with respiratory symptoms, and a few that have been very severe from the just sort of standard COVID presentation. As far as the multisystem inflammatory syndrome goes, especially with this enormous surge of cases in the winter, we had just as many kids come in with multisystem inflammatory syndrome, even probably a little bit more over sort of the January, February, March timeframe as we did last April and May. So that's a lot of kids with very who come in very, very sick.
Thank you. You've certainly touched on quite a bit of areas that we were going to ask about. So it's probably not necessary for me to ask about Miss C unless you think there's something additional we should know or parents might be interested in knowing in terms of the manifestation of Miss C or even Kawasaki disease as we head into the summer.
Sure. So, I mean, again, it's just, something to be on the alert for. The kids generally present with sort of high and persistent fevers. I think this summer's potentially going to be a little trickier potentially in diagnosing, just because we do know that a lot of other viruses are now circulating. So last summer, there really were very, very few because everybody was masking, everybody was keeping their distance. And now that people aren't doing that as much, we're definitely seeing resurgence of other common respiratory viruses and other infections and things. And so, there may be a little bit of a harder time to try to sort out kids who have, more severe, the beginning at least of some of these more severe manifestations. But obviously, definitely people need to stay in touch with their pediatricians. And if they're, significantly concerned, that they should absolutely, bring their child to the emergency room or absolutely call their pediatrician. And, just be on the lookout and, especially if you've had a recent exposure to COVID or anything like that, get tested. There's still, that's a huge difference than we had last year as well, although we had the availability of testing probably better in New York than in most states at the beginning of last summer. Now it's everywhere, and it's still free and it's readily available. And many pediatrician offices have some of the rapid tests right there. And so if your child's sick, especially if you're considering sending them to camp or going on a trip or seeing potentially vulnerable relative, especially an older relative, that it's a really good idea to get tested. And because kids can have very mild symptoms, or even no symptoms and spread the virus. So we do want to continue to be vigilant about our kids when they have respiratory symptoms and definitely be testing.
Thank you so much, Dr. Nolan, especially for parents that have the little ones that, today I watched my child for the first time interact with her peers as she's been remote. And, I cringed a bit, and touched objects and played in the field day, but it just brought her so much joy. So, having said that, it brings me a little hope. But at the same time, we have to be grounded and realistic that COVID is not completely over. But it does lend to the next presenter who, I have met through our equity task force, Dr. Etienne, who will tell us a little bit about himself and the role he is playing, particularly during COVID, and how he's working really hard to help with vaccination so that parents like me can feel a little bit more relief, even though my child is too young to be vaccinated at this time. But I still feel a little bit more relieved knowing that the people around her, the teachers, the camp counselors may be vaccinated. So, Dr. Etienne, the floor is yours. Kindly tell us a little bit about yourself and the role you've played during the last 16 months or so throughout the pandemic.
Great. Thank you very much for having me on this panel with this distinguished panel of guests. But I'm a neurologist. But what's happened during the pandemic is a lot of physicians have found themselves doing things that they weren't, different scope of practice from what we were typically trained to do. So initially during the pandemic, I was, I work at Good Samaritan Hospital, part of the WMC Health Network. So initially I was involved with helping, set up with the testing at the hospital to get as many people tested as possible. That was the first phase of the pandemic. I am in the Navy, and so at the peak of the pandemic in New York City, I actually got deployed and went to the Javits Center and was there for about 2 months. And then after returning, I resumed my regular neurology practice, but then subsequently became part of the Health Equity Task Force. And as you know, I'm the head of the Health Equity Task Force for the Hudson Valley. And there's a few things that we're concerned about, but right now, the phase that we're in now is, vaccine distribution. So one of the main goals of the task force is making sure that there is an equitable distribution of the vaccine. So as many people know, when the pandemic first started, the health inequities, which we've known about, it was kind of almost like kept secret. Now it became very obvious. Now everybody knows about the health equities because we saw the disproportionate impact of the pandemic on the Black and Brown communities with low socioeconomic status. And a lot of that had to do with structural factors that we know were in place beforehand that made those communities more vulnerable to getting exposed to the virus and then getting sick from the virus because of certain pre-existing conditions that many of these people had. So what we kind of expected it that when the vaccine rolled out, that there would probably, those communities that were hardest hit would probably not be the ones to get it. So no surprise. That's what we started seeing at the beginning of the rollout, that those communities were not getting the vaccine as much. And there were many reasons for it. A lot of it had to do with there was not a lot of vaccine available. We had limited supply. Some communities may have had some skepticism about the vaccine, how quick it came out, and how much testing was done. It's an emergency use authorization, not an FDA approval. And then it had to do with where were the vaccines being allocated, which communities were getting supply of the vaccine that was available. And so a large part of the Health Equity Task Force's job was to look at that, look at the data, see what's happening, and find ways to have a more equitable distribution, make sure that everyone who wants a vaccine can have a vaccine. I know we hear it on TV. If you want a vaccine, you can have a vaccine. We wanted to make sure that was true so that our politicians and the people on TV who were saying that were not lying. And so we have been able to do that by, helping to set up with working obviously very close collaboration with the state, these mass vaccination sites. We've seen that having longer hours for the vaccination sites, having, not just a standard 9 to 5, early morning, late night, because some people have to work. We want to make sure that they can get the vaccine, weekend hours. And then we started looking even more closely at the data, seeing what places are people still not getting vaccinated. So we saw those communities that weren't getting as much vaccinations, and started targeting them with pop-ups. Setting up pop-ups, whether it was at churches, different places, places that people trust, so that the vaccine, so that people can have access to the vaccine. Now, a big part of what the task force has also been doing, which is what we're doing right now, is education. So if you want people to take a vaccine, especially one that was developed quickly, you want to make sure we're educating the public, make sure that we can explain to them how this came about, that we got the vaccine this quickly after the pandemic started, go over the risks and benefits of getting the vaccine, making sure people are up to date as far as who's eligible for the vaccine. As you know, at the beginning, there was, first responders, frontline workers, and people over a certain age, and we gradually changed that. But if you're changing it, there's something called change management. You could be changing it if it's not well publicized. Nobody knows, so people won't know that that more people have access, more age groups now. We're down to age 12 having access to the vaccine. So if people don't know that, they might not know to go in and get vaccinated. The other thing was, at the beginning, we know there was short supply and people had trouble making appointments. Now we have plenty of supply. So people may have given up before and said, oh my God, I called the number, I was on hold for a half hour, I couldn't get through, and then the call dropped, and oh my God, and all this crazy stuff happening. So now we need to make sure people know, if you call, if you go wherever it is, you will get the vaccine. So there's no more long waits. This vaccine is readily available to anyone who is, obviously, if you meet the appropriate criteria. Mainly right now, the only real criteria is your age. So we want to make sure that everybody's getting the vaccine. The other thing that needed to be dispelled, where people were worried about their status as being, documented versus undocumented. Am I going to get taken out by some government agency when I go to get my vaccine? That's a realistic fear. Who's to say you weren't? That's why we have to educate the community and say, no, we want you to get vaccinated, because the more people who get vaccinated, the safer all of us are. I'm in the Navy, so I'm going to say it's an all hands on deck. We want to see all hands on deck. Everyone needs to get the vaccine. That's how we're going to protect our community and make sure that we're all safe.
Thank you. You spoke to, the youth vaccinations and how we've now moved to 12-year-olds and up that are able to be vaccinated. And this morning, you shared a slide that I would like to share with the public, if you don't mind. And if you could kindly just speak to the gains that we've made for our young people in terms of vaccination. So this time I'm going to just share that document. Haha.
I can share it also if you're having trouble with it. You got it?
I actually have stopped sharing because I'd like for you to share if you could. I had two pulled up, and it seems I'm in the other.
Okay, let me see. Let's see if I can share that. Oh my God. I think
My screen looks like yours. If not, I can share.
do you see my screen there?
It is gray.
Do you see the vaccine?
We do not. We see it now.
Okay, great. Yeah, it looks like it was just a delay in transmission. So yeah, so what you see there is the bottom line, for those who aren't used to looking at graphs, on what we call the x-axis, which is down here at the bottom. Those are the age groups. The y-axis, which is the vertical that you see here, shows you the percentage of people who are vaccinated. So we're looking at each age group and seeing what percentage of the people are vaccinated. And what we're seeing no surprise, the 65 to 84-year-old age group, 80% of them have gotten at least one dose of the vaccine. The 85 plus, we're at 70%, but we want to look at the youth and see what's been happening there. So as you know, the 12 to, we recently got the authorization to start vaccinating these younger people, 12 to 15-year-olds. And we see that already in this area in our region, 26% of them have already gotten at least one dose of the vaccine. And I give credit to this youth bureau and others who have been educating our youth and their parents about the importance of the vaccine. So obviously, you might say, "Well, wait a minute, they're low. They're lower than everybody else." Yeah, they're low because everybody else had a long head start, right? It's because we didn't get the authorization to start vaccinating the youth because we had to wait until we had enough data available. We wanted to get the appropriate data, make sure it's safe in the youth. And now that we know it's safe, we started vaccination. So for the 12 to 15-year-olds, that's the latest group that got access, we're at 26%. 16 to 17-year-olds, they've had a bit longer access than the 12, 15. They're at 47%. Okay, so these folks are really going out there, getting their vaccines, which is important, right? Because we're talking about potentially going to summer camp. We're tired of having online schools. We don't like the virtual. People don't want to do virtual graduation. Who wants to go to a virtual prom or a virtual, anything? It's not, some things are okay virtual, but some other things are really more designed for in-person. So if you want to get back to having all these great in-person activities, we want to get as many of these youth, particularly, vaccinated. And we see the 18 to 21-year-olds, they're at 43%. So these numbers are encouraging. But we still want to keep pushing that number up. We want to see these teenagers up towards where we see these people who are 65 to 84. We want to start hitting those numbers. And I think we will, as many of you probably saw on the news and on social media. The state is pulling all the stops. They're saying, hey, you get your vaccine, you might have a chance to win the 4-year scholarships to go to college and other types of incentives. So I think it's obviously this is a good thing. So we want to see these numbers keep going up. So yeah, thank you for sharing that slide.
Thank you for sharing the slide. I was going to share another presentation, it seems. But that is very encouraging, given the short period of time that we've had to have young people vaccinated, and the gains we've made has been significant. So that is very encouraging. I'm going to just take a moment to brag a little bit about our Department of Health under the leadership of Dr. Amler. We've had control measures that have been highly effective, and I think everyone's been doing a great job in terms of isolation and quarantining and social distancing. But Dr. Etienne, could you talk a little bit about the guidance with the CDC? And, I know it's meant to supplement and not replace. And of course, we are not, although we are presenting through Westchester County government, we are not the authority in any way. But if you wouldn't mind just speaking to the guidance on the safety regs and the changing landscape, because parents would like to know what they should do. I mean, as you said, we're kind of fatigued with the virtual world, and some of the guidelines have shifted and changed and could possibly change again. But if you could kindly speak a little bit to the CDC regulations, that would be useful.
Yeah, absolutely. And as you just alluded to, I think one of the things that we've all learned from this pandemic is the importance of being flexible. I've always told my medical students and others, I said, when you're going into the practice of medicine, you got to be fluid, flexible. And now the pandemic has said, you're right, Dr. Etienne, you have to be flexible. And so the guidelines keep changing. But I think right now, at the beginning, they changed quite a bit. Now we're in a much better place where we have a lot of data. We have a much better sense of what we're doing. We know we've got vaccines that work, and we see how low the transmission rates are. That once you've been vaccinated, the likelihood of spreading the COVID is really, really low. And so that's why the CDC has said, if you've been vaccinated, once you're 2 weeks after your second dose, or if it's a Johnson and Johnson after your one dose of Johnson and Johnson, that you can now, in certain places don't have to wear a mask anymore, and those types of things. So, and the CDC, it's good to have a central body for the country that gives guidance, because then what states can do, states always have the right to be more restrictive. So even though the CDC gave this guidance, New York State has to look at that data and say, does that make sense for us? And if you're in a state where the numbers are, going up and it's a big boom, you're not going to follow that guideline. You have to do what's safe for your state. And then even more specific is after you go from the state level, we want to now look at the county level. What I just shared with you, the data was the data about our youth and our people in the Hudson Valley. Those are not numbers for upstate or the city or all these other places. So there's different things happening in different places. And so if a leader in a particular area says, "Oh, we're really things are really crazy here right now," they might make it more restrictive. But that's the way these guidelines are happening. And that's why, you look at once, people might get confused. Well, how come in this state you can do this and this other state you can't do that? But it's all based on what's actually happening locally. So we have to really be smart about it and see what is happening in that state. I'm going to be traveling to, I travel to a different state. I check to see that state's Department of Health website and see what is happening there. Because by knowing what's happening there, I know what precautions I need to take when I get there. Because if imagine I show up to a state where it's booming and I'm walking around with no mask, people are going to think I'm, oh my God, this guy's crazy, and he's a doctor too. So you want to make sure you know what's going on wherever you're going, so that you're following the recommendations and not, putting yourself or other people at risk, and really you don't want to cause a scare in those communities.
Thank you. Dr. Etienne and Dr. Nolan, we appreciate your accurate medical advice. And we hope that you will remain on, because we do have some questions from parents that we have selected because we couldn't answer them all. But at this time, I'm going to ask my co-pilot, Reverend Smalls, to please jump in so we can talk with our CEOs of the Boys and Girls Clubs. We're very fortunate to have from Northern Westchester as well as from Mount Vernon. So from two opposite sides of the county, yet they have distinct expertise in dealing with young people and positive development. So the floor is yours, Bev.
Excellent. Thank you, everyone, for your wonderful information. So this whole discussion is just so great and so important, because people just want to get the facts. They want to know what's going on so that they can figure out what next steps they can do. We do see that things, at least in this state and in this county of Westchester, things are loosening up. People are starting to do the things that they used to do, but there's still lots of questions. So let's start with a brief introduction of the Boys and Girls Club of Northern Westchester and the Boys and Girls Club of Mount Vernon. So could you please share with us a few examples of how your organization weathered this once in a lifetime COVID-19 pandemic? So any one of you can start.
Well, I can start. Thank you for having me on the panel, and thank you for the great information. On March 12th of last year, we were conducting our Youth of the Year.
And so, Mel, could you just tell us your name and which Boys and Girls Club, which organization you're representing?
I'm Mel Campos. I'm the CEO of the Boys and Girls Club of Mount Vernon.
Excellent.
On March 12th of last year, we were having our Youth of the Year event. And during the course of that event, calls came in from the city Reports were coming in that this thing was happening and that we needed to make some decisions about what we were going to do. Nobody really knew what was going on, but we made the decision to close. Um, and from March 12th to March 23rd, we didn't do anything, but we knew we had to do something. So we started a virtual program on March 23rd. And on March 23rd, when we came on, 6 kids came on. I was, oh my God, what is going on? This is terrible. But eventually we went on and had 63 kids come on by the end of our after school program. But a couple of things became very, very clear to us. One was that while many people thought, oh, the kids are at home, they're gonna be fine. For some of our kids, they weren't fine. Being at home was not the best thing. So we talked with our board and asked that we be allowed to open a limited summer program. I asked for 56 kids. The board approved 40. I didn't argue. I was glad that we would be able to serve kids because we saw a lot of things when you're online. You get to see some of the things that are going on behind the scenes, and in some instances, what we saw going on behind the scenes, we knew was not good for children. And one thing that happened that blew many of our minds was we would do the younger kids during the afternoon till 6:30, and then we do the teens from 6:30 to 8:30. And one night we were there with the teens, and shots rang out behind one of our young ladies' window outside. I'm sitting in my home in my wife's office, and I dove under the table. And her reaction was, "Oh, they're shooting again." I knew that we had to provide a safe space for our kids. So on July 6th, we started a limited summer program. We did it with a lot of precautions. We were not allowing parents in the building. We set up a table outside when the kids came in. We took the temperature outside. Everybody was masked. We had gloves. We went through more hand sanitizer during the summer than we ever had before. And our parents were incredibly supportive. The kids behaved better than they ever had, and our staff followed the rules and took care of the big things. But some of the other things that we did, we realized that our community suffers from food insecurity. So we started doing, while the club was closed, we started doing the food distribution and clothing distribution every 2 weeks. It started out with about 20 families. We have continued to do that through this past week when we had our last one for the school year. And now we have about 350 families pass through. We provided as much emotional support as we could to kids and families, to our staff. I mean, we were all affected by it. And as a club community, we did all we could to support each other. But most importantly, we did have a safe space for children to come. Although it was only 40, during the summer, we generally have 130 a day, but we were able to service 40 kids, and it made a tremendous difference for them.
That's awesome. I was going to ask you about your staff. I'm so glad that you were able to provide those services for the community and the student, the children members, the youth members, but the staff. How, just very briefly, what resources or anything were there for your staff and yourself?
Well, I mean, for our staff, we really rallied together and really talked about what we needed to do, why we were doing it, and the staff is always good. But during the pandemic and last summer and through this after school program, there was a new level of collaboration, of support, and people really understanding we need to work together so that our kids can get the best possible service that we can offer. And it worked. And I always tell people that the big things, they were champions. Some of the little stuff that happens with staffs did happen. But the big things in terms of being safe, in terms of following the protocols, we checked each other. Once or twice, and it was new to all of us. And, I would walk out of the office without my mask. And they said, "Mr. Campos," and our signal was, so, I got a couple of times, but
That's excellent.
it was really good to see people rallying because we knew also that if we did not follow the protocols and if something went wrong, we could be shut down in a heartbeat. I'd have to make the decision to shut down if I didn't think we were operating in a safe manner.
Excellent. Thank you so much. And I'm glad that the Mount Vernon Boys and Girls Club has weathered well. And I hope we'll talk more about what activities are going to be happening in the summer. But before we do that, um, Aliza Ozar from the Boys and Girls Club of Northern Westchester, how did you and your staff and youth weather through this once in a lifetime pandemic? You can unmute yourself.
I'm honored and proud to be the CEO of the Boys and Girls Club of Mount Kisco. Thank you for including me in this conversation, and thank you all for your extraordinary leadership. I think we all learned through the last year and change that partnership and community is pivotal in ensuring that we are strong and safe and continue communications. We were in a very unique position relative to serving the community in that the club has been in existence for 82 years. And we have very strong partnerships with Westchester County, with Northwell, with hospitals, with our local school district. Mel has been extraordinarily inspiring, and we work with all the different Boys and Girls Clubs. So we never actually closed. On March 13th, the state mandated that Mount Kisco serve to provide childcare for first responders and healthcare workers. And we have a very close partnership with Bedford Central School District, and we served in that capacity to fulfill the requirements of Mount Kisco. So we have a partnership with Northern Westchester Hospital for many years, and I got within 24 hours a phone call from, Derek Anderson, the president, saying we need to work on this together to ensure the safety of our community. We put tents outside within 24 hours. We were open from 6 in the morning till 9 o'clock at night, so that the people working within hospitals could get onto the floors. We maintained our full staff throughout the entire time. Some of the challenges that we experienced that we would never have anticipated were just simple common sense things. We had alumni who didn't have the financial wherewithal to get back home. They were in colleges and they were given very short notice that said within 24 hours you need to leave campus, right? So we serve children ages 3 through 18, and we run about 40 different types of programs. So one of the first priorities was getting the alumni back home safely. Then the second item was computers. So although we're blessed to have computers on site, over 82% of our families pre-COVID did not have home computers. So we partnered with Bedford Central School District to ensure that we distributed over 890 computers. And then, simple things like, our families didn't have Wi-Fi, right? So it was ensuring that they had the ability to communicate. And even though extraordinarily well-intentioned, the school district was sending out emails, the majority of our families, since they didn't have computers, they don't read their emails. You need to communicate with them via text. So over 72% of our after-school programming families are living at or below poverty. And because we've been blessed to serve the community for 82 years, we have very close relationships with the community. So what we found was we just started calling people immediately to see what was going on in terms of their needs. And as Mel said, one of the things that we learned very early on was food scarcity. Many of the food pantries in Northern Westchester, many volunteer-based, had no choice but to close. And so we came to Westchester County and said, what are we going to do? These people need food. And because of the extraordinary leadership of the county and Feeding Westchester, we put together a weekly food distribution, which is not something we ordinarily do to that extent. And in a period of 10 weeks, distributed 190,000 pounds of food, whereby we were having up to 3,000 people come each time for food distribution. So, you talk about partnerships. We partnered with Westchester County Police Force. We partnered with, our immediate municipality in terms of Mount Kisco, with everybody coming together to ensure that we were able to provide food that was necessary. And as I mentioned, we stayed open the entire time, but then in some instances, as Mel was sharing, our families, they didn't necessarily always have parents at home. So it wasn't negotiable. Like, the kids needed a safe place to be. And that also included food. So we're very fortunate to have on-site food prepared. We serve over 100,000 meals a year, but now we were open to that many more hours. So then we had to increase up to 4 meals, of food a day. But the team, came together, as Mel talked about, and we continue to partner with, all of the various organizations. You talk about the importance of vaccinations. Many of the opportunities to sign up for the vaccinations required people to have an email and a printer. So you needed to be able to show up to get your vaccinations. And what we were finding was the community, not everybody had that opportunity. So we also opened our doors to be able to have families have the opportunity, where we were trying to coordinate on their behalf for their various appointments. Currently, we have 98% of our staff. We have about 70 full-time, 125-ish all in, all vaccinated. And that also includes junior staff. So that's something that enabled us to feel that much more comfortable earlier on in terms of protocols. We're licensed through OCFS as well as Westchester County and, Department of Health. And our protocols were very strict and have been from the very outset, which is what enabled us to remain open. So we've been busy.
Wow, well, that sounds great. I'm glad that both of these centers are really providing critical services for our youth and families. But let's just switch gears because we want to be aware of time. So the big thing that's on everyone's minds, we've had our doctors, Dr. Nolan, Dr. Etienne, give us some wonderful information about how COVID impacts people, the vaccines, and all that other stuff. But the main thing parents and kids want to know is, can I go to camp? What is camp going to look like this summer? So Dr. Etienne has given us a chart showing that, vaccinations is looking pretty good. Adults, youth seem to be beginning to, buy into this whole thing. But let's talk about summer camps. So could you just Mel, and we'll try and do a round robin so we can get through a whole bunch of questions. So the importance of summer camps. How do you feel, with the Mount Vernon Boys and Girls Club at this point? What would you say to parents and young people watching why and if summer camp this summer is so important?
Well, we are open this summer. We have been approved for 90 kids this summer. As the doctors have said, it's getting better. We're not out of the woods, but we are continuing with all of the precautions that we put in place last year. We will be doing a comprehensive training for our staff with an emphasis on safety. We will continue to set up our table outside. We will continue to greet the kids outside. We will not have parents coming in. You know, if they have an appointment, we'll set up an appointment and have them come into the club, but they will not be able to just come in. You know, as in the past, the parents are always welcome to come in, but now as a precaution, we have two staff, our director of safety and security and another staff member who are there. We have a junior staff member who will bring the kids into their assigned areas.
Mel, in addition to the tactical, all the planning stuff, which sounds great, from what you already told us, we already know you got that down. So I think the burning thing that people want to know, however, is explain to us why summer camps and summer programs are so important.
Well, social interaction is
Excellent.
the answer. You know, our kids, one of the reasons they behaved so well last year when we let them in is because they wanted to be out and they wanted to be with each other. So having kids being able to come out and be kids and be able to have fun. You know, one of the things that I'm very concerned that has happened is that our kids across this country have pretty much lost 2 years of school because the online schooling hasn't worked so well. So kids have to get out and interact. They have to be reintroduced to learning, but we also have to remember that kids have to have fun. That while they're and an emphasis for our summer program this year is to make sure that the kids are having fun. Education is a big part of what we do during the summer, but we have a philosophy that I call sneaking education in through the back door. You know, we're not going to sit them in the classroom and say 1 and 1 is 2. We're
Right.
going to do activities. You know, we use a concept that Elisa's familiar with, Project Learn, which means that everything that we do, we're teaching, although we're not teaching in the traditional sense.
Right.
And that is very important for kids. Kids learn while they're having fun. Kids
Yes.
learn while they're comfortable. Kids learn while they feel safe. Kids learn while they have a good, healthy meal. And these are all things that we're emphasizing, that we're doing to make sure that our kids have the best experience
And
possible.
very
Yes,
quickly,
kids need to get out.
thank you so much. Very quickly, how would a parent or a child who's interested in this be able to connect with that?
Okay, so the easiest way is to go to our website, bgcmvny.org. Applications are available there. We also, you can call us at the club, 914-668-9580. Someone will answer the phone from 8 a.m. in the morning till 8:30 at night. You can come to the club. We have applications available. And
Are there any fees?
there are fees. If you sign up and pay by June 11th, it is $750 for the entire summer, all inclusive. It's 7 weeks from June 28th to August 13th.
Excellent.
And that would cover everything, all the meals, the trips, the t-shirts, swimming.
Everything.
We have the children will go home ready to sleep at night and to give the parents a break. I guarantee you. But
Thank you so much.
please reach out, and we're happy to give tours and to talk to parents about what we're doing. And the best way to get a sense of what we're doing is to stop in, and we'll arrange a tour for you, and you'll see us in action. You parents are generally pretty happy with what they see at the club.
Okay. So, Aliza, this question is about how can your Boys and Girls Club encourage and model appropriate and healthy peer relationships during camp while also maintaining distance and keeping kids safe?
Sure. So first of all, we were fortunate enough to be open last summer. So we've had some experience on how kids have an opportunity to be outside And minimally, we work in cohorts. So we have 12 to 15 kids per group. And this summer, it has just been cleared that you can have 2 groups involved in a particular sport, but then they would not commingle with anybody else in the camp. Whereas last summer, we couldn't even do that. So we are extraordinarily excited because it opens it up to sports. So a lot of, I would say our key differentiator in terms of our programming is civic advocacy, leadership, and giving back to community.
Mm-hmm.
So when you're dealing with 3-year-olds who are making capes for kids in the hospital to learn the importance of empathy, or it's our teen programming in terms of giving back to community and, wrestling with some difficult issues that they may be dealing with our different types of programming. A lot of what we do is one-on-one work with small groups. So teen programming, our keystone leadership would be 15 young teens to begin with, workforce development leadership. So it is a very fine balance. We want to ensure that the kids are safe. So all the safety requirements in terms of temperatures being taken, questions being asked, we don't mix and match, the various groups, which also, from a business perspective has been extraordinarily challenging because that means that the teachers and youth development professionals are assigned only to one group.
Are
So
either
we've
one
had
of you requiring vaccination for kids 12 and older? Any vaccination requirements or anything like that?
We are recommending, we are not requiring, and the guidance that we've received from Boys and Girls Clubs of America is that we cannot require.
Excellent.
But
The same
we're
with you.
encouraging.
So that's the same with you too,
Yes.
Eliza?
Yes.
Excellent.
Yeah, but we do
So-
have, we also do have throughout as I said, 98% of our staff, including counselors and the younger staff, have all been vaccinated. So that does make a big difference, making parents feel more comfortable. And then we also have, testing if there are long weekends, and there's a very
Right.
succinct set of questions when people are walking in. And we've also, last year as well as this year, having nurse on site in case anybody's not feeling well. So those are some of the safety precaution measures. But, as to what Mel said, we are human creatures. And we also, with the support of Westchester County Youth Bureau, had remote programming going on site since September. So we had kids in the building from, as I said, 6 in the morning till 8 at night. And they've just been in front of screens for so many hours. We've actually seen, the doctors can address this, physical muscular atrophy. Their ability to focus is not as good as it had been historically. They don't have as much time to interact. So one of the things that we're implementing with all the ages is, remember how to talk to your friends in a respectful manner, and just to be able to, have an opportunity to
Interact
communicate.
with other people. Yes. So just give us very quickly, Mel in Mount Vernon said that his summer camp is from June to August, and your dates are the same or different?
Yeah, we have orientation starting in a week and a half. We go through the end of August. We also have a very, very robust Learn to Swim program, as well as swim team. Swimming starts at 6 months. And we also, that goes 12 months out of the year as well. And we've been in the pool because, ironically, with chlorine, as well as very succinct safety measures, our campers this summer, all of them, as well as preschool, all have swim lessons.
Okay, excellent. So it is 7:08. Do you think we have a time for like one question, maybe, Dr. Madden Harris?
I think we should ask a few of the questions since we had so many from the parents, and therefore everyone here. So,
Yes.
if the doctors don't mind and the CEOs don't mind, I know time is precious, but if we could go to about 7:15 and just have some really quick questions, so that some of our parents that will be watching can maybe hear some questions that they have. I'll start us off since I have my mic unmuted. For the doctors, what ages are the COVID vaccines now approved for? And if I have an 11.5-year-old, can they be vaccinated?
So right now, the Pfizer vaccine is available for 12 and over. 11.5, unfortunately, no. The safety data hasn't come in yet for those children. Right now, there are studies ongoing, and both the Pfizer and the Moderna vaccine companies for those vaccines anticipate that by the end of the summer to the beginning of the fall for 5 to 11 age range, that we should have data for those children around that time. And then, for the 6 month to 5-year-old age range, hopefully by the end of 2021, we should see the data for them.
Okay.
Okay, excellent. This is for everybody. And again, these questions all come from parents throughout Westchester County who are interested in this topic. So they sent in these questions. So this is for everyone. The question is, my child is too young to be vaccinated. Is it safe for me to send my child to summer camp? What
So I can
say?
start that.
Yes, Dr.
So
Nolan.
so I would say yes. We've definitely learned strategies where with schools, and we have a lot of experience now, and we have a lot of data to support that the mitigation strategies with masks and hand hygiene and physical distancing work and will keep us safe and keep the virus from spreading. So, I think a lot of camps started last year, and as Lisa and Mel have said, they were very successful, and we've had a lot of success. So I think I'll let them speak more, but absolutely, I think there are ways that it can be safe as long as you make sure that they are following, specific protocols. And the more people vaccinated at the camp, so, with counselors and all that sort of thing, vaccinated, that's going to help keep your child safe as well.
Okay, this question is about older youth. So this parent wants to know, my older child wants to work at a summer camp. What precautions should they take to do that, to remain safe and have fun and make some money this summer?
Yeah, I mean, ideally, it goes to what we've been talking about, is ideally that child, since you're saying older child, I imagine that means that child is a teenager, which means that child should be eligible for a vaccine. So I would recommend that that child get the vaccine. And it's also, I know the panelists have said, a lot of places aren't requiring the vaccine, but definitely you want to, I like what they're saying is that they're encouraging it. So not being completely neutral, saying, well, do whatever you want. But if you say, we really would like you to have the vaccine, it's gonna, that way, people feel more confidence that more of the staff are vaccinated, more of the leadership are vaccinated. You're setting a good example. So then a lot of times the parents might see that and also get their children vaccinated, because having more, the more people in that environment who are vaccinated, the safer the environment becomes for everyone.
Excellent. And this final question, I'm not sure but we'll just ask it. Will contact tracing remain intact despite the loosening of COVID-19 restrictions? I mean, I could answer it, but I want to hear what other people have to say.
I think just from the perspective of Boys and Girls Clubs, and this is the case with all of our clubs, it's a family. So one of the unique opportunities that we had early on, having been, struggling with this for so long, was we know, everybody who's related within the community, sometimes even more so than the public schools do. So our protocol was actually even more strict than the Department of Health in terms of family relations. And we had the ability, because of everybody working within the organization and because of our closeness with the community and various partners, to obviously work in conjunction with the Department of Health, who has been extraordinary, but to really go beyond what was even suggested on the tracing, which is so essential to be preventative.
Excellent. Mel?
And I would just add, although Dr. Amler is not here, and I certainly cannot speak to her expertise, but I know that she is very compliant when it comes to contact tracing and, isolation, quarantining. During the school year, there was, she was very adherent to the rules, and really just to protect our young people and their family members. So, I don't know what Dr. Etienne or Dr. Nolan would say to this. I think it's worth exploring, though, just for another couple seconds, because I haven't heard that the contact tracing component has been alleviated. And Reverend Smalls, you're a contact tracer, so you might know
Yeah,
this.
so I'll just jump in and give the breaking news. So the initiative is scheduled to come to an end in the summer, by mid-August. However, as uh, Aliza has mentioned, contact tracing is an activity that can still be carried out by various groups and organizations. So different municipalities, the Boys and Girls Clubs can do their own version of contact tracing. So I think those initiatives will still continue. Colleges also do the same thing in terms of keeping track of staff and students. Um, so that's the breaking news in terms of the New York State initiative, is scheduled to come to a close by mid-August. And this is actually good news for us as citizens. For people who work for the initiative, it's like, oh, womp, womp, womp. But it's good news because the rates of the spread of the virus now are really low levels. The rates of vaccination are reaching very significant levels and seem to be increasing. So, with all those indications, we are not in the crisis mode that we were in last year or even like 5 months ago. It was a whole different scenario with the rate of infections. Um, the vaccinations were just rolling out. They were only available to a small segment of society. Now it's pretty broad base. We've gone down to children. And as Dr. Nolan said, even younger children, probably by the fall. So that's where we are with contact tracing. Um, and
But before we move on from that, I'd like to hear from the doctors because, I have to make the disclaimer for the Youth Bureau. We're not, the authority of that, and I'm not aware. And I thank you, Reverend Smalls. I know in your professional role, this is what you do. But I'm just curious to know, has there been any discussion regarding, the ending of contact tracing on your side?
So in the hospital and on our side, no. That's something we do in infection control in the hospital all the time, exposure investigations and that sort of thing. So from that standpoint, no. We take it at a sort of different level because we have a very critical population within the hospital. As far as I'm aware, for the public, that will definitely be a Department of Health decision and something coming down, I'm sure, from the state and to the local departments of health. How long that will go on. Hopefully more and more and more people will get vaccinated and the need for that will go down. I think, depending on the availability and eligibility of younger children for schools, that will be something, that will have to be thought about and decided upon as, when kids go back to school and whether quarantine requirements are still in place and all of that. So, I think it's, again, that sort of thing, it will be evolving. Maybe they stop it for a period of time, but, most likely, I suspect we will have a winter surge again, like we do with many other respiratory viruses, and whether or not it's needed at that point, we'll see. But I think we're all awaiting probably further guidance from the CDC as well as all the state and local health departments for that.
Thank you. Dr. Etienne, anything to add or final remarks?
Yeah, no, I mean, I agree. The hospital is a very different environment from the the community. So I agree with that. I'm not as involved with the contact tracing right now. I did it at the very beginning of the pandemic, but I haven't been doing it, as of late. So.
Well, thank you. I'm so happy that we have, a diverse panel that can have this conversation so that, parents aren't left without any information. Certainly, we just await as things change and, the landscape is ever changing, as we keep saying, and pivoting, which is the code word now for COVID. But I just like to say on behalf of the Westchester County Youth Bureau, we thank you so much for spending this time with us, additional time with us. As a matter of fact, I think it's a lively conversation and it's always worth having so that our young people, our families feel a little bit more prepared as they start to venture out. Some of us are tiptoeing out and others are just jumping right in. So we want to thank you, and we want to say we greatly appreciate the Boys and Girls Club of Northern Westchester and Mount Vernon. And we appreciate all of our youth service providers. We have a number of organizations that will also be allowing camps and summer programming to happen. There were some questions about like programs on college campuses that we just can't get to. And we may be reaching out to you all just so that we can formulate responses to some of the parents. But I will say that the Youth Bureau is putting together a summer directory. So it will include programs as well as summer camps. Obviously, the Boys and Girls Clubs will be included in that, but so will be the YMCAs, YWCAs, the faith-based organizations, the school-based organizations, so we hope to have a comprehensive document soon, and it will be available on our website. But right now, I would like to say to the public, if you have or know of a camp and have all the details, please visit our website, which is the westchester.gov website under the Youth Bureau. And there is a form that you can complete if you would like to be included in our summer directory. I want to thank my co-pilot tonight, our prominent board member, Reverend Smalls, for joining us and lending his expertise to the conversation. And again, to the experts, Dr. Nolan, Dr. Etienne, it's always a pleasure having conversations with you. And of course, Mel, Eliza, we couldn't do our work without you. So we're going to end this portion and end the entire segment with a wonderful commercial that was put on with the communications department about vaccines.
I was excited when I was able to make an appointment. Hi, I'm Ella Roth. I go to Horace Greeley High School and I'm 18 years old.
Everyone I go to school with, we work with, they're eligible to get it now. It's not just, the elderly people. Hi, my name is Jonathan Guzman. I'm 24 years old. I go to school in John Jay in the city.
It's the beginning of the long road back to normalcy. Hi, my name is Greg Hunter. I'm 22 years old and I go to SUNY Purchase.
I got the vaccine because of family. Hey, I'm Austin, 19, go to University of Arizona.
This is my first time returning to seeing my family in over a year. Hi there, my name is Hannah Bayless. I'm 23 years old. I just graduated the University of Vermont.
Family for me is a big part of, my life. I'm Hispanic, we're very family oriented.
I live at home with my mom and my grandmother. She's 88, so I wanted to make sure I did my part and make sure that she stayed safe as well. If you're hesitant, just do it. Be fearless, get vaccinated.
It's very easy.
It's so worth it. Please do it.
So our job is done, and hopefully we will have viewers, and we encourage parents to tune in, and we encourage our providers to share this information. As Dr. Etienne mentioned, education is really key at this point. The more informed we are, the better we will be. So thank you again.
Thank you.
Have a wonderful night.
Yeah. Bye-bye, everyone.
Have a great night. Thank you.
Take care.
Thank you.